Hi, everybody. I'm Ellen with Advanced Massage Therapies here in Carrollton, Georgia. And last week I had Megan Rogers in my office, and she has quite a local social media following. And we put out the video for her social media, and I realized that my following doesn't know Megan. So, Megan is here to tell her amazing story, her incredible journey she's been having with cancer. And so, Megan, take it away. Tell everybody
Yeah.
your story.
Well, thanks for having me on. Yes, my name is Megan. I'm here in the Carrollton area for, gosh, my entire life. And my mother actually had breast cancer 2 times when I was growing up, and then she passed with uterine cancer. It actually had spread into that area in 2020. At that time, my sister and I both were genetically tested, and we tested positive for the BRCA2 genetic mutation. So you're more likely to develop breast cancer, ovarian cancer, and then it can also spread to pancreas or melanoma. So I was actually pregnant with my fourth child, and at 39 weeks pregnant, I was diagnosed with stage 3 triple negative breast cancer with it was an 8.4 centimeter tumor in my right breast. And everybody always wants to say, you had no idea that's a tennis ball. So, backstory for the last two babies, I developed fibroadenomas in the right breast, and they had the ultrasound done, the diagnostic, all the things. And they did the mammogram because I actually wasn't pregnant with those. I was nursing. And I was told that they were hormonal, they would grow, and then they would go back away. And they actually told me I didn't need biopsies for either one. So when we developed the growth in this last pregnancy, we assumed it was another fibroadenoma until around about 26 weeks when we reported it as showing activity. Like it felt like my milk was letting down. For those of you who know how it feels for your milk to let down while you're nursing. But it just wasn't a concern for anybody because of the fibroadenoma history. So fast forward to 39 weeks, and it is actually indeed breast cancer. It's been an interesting journey. We had to jump pretty quickly from baby to labor and delivery, and then straight into, I think I had 10 days to spend with my family before they started putting me through all of the major testing, made me radioactive, the PET scans and the CTs and all the things, the breast MRI. I had my port surgery on the 17th of October after having the baby on the 7th. And from there, it's just been a crazy chain of events into chemotherapy. 6 chemotherapies down, found out that it was actually indeed not triple negative breast cancer. We had two more very prominent cancer institutions do a second pathology read, second and third, and they both agreed that it was actually a PR positive cancer. So I did receive some breast cancer medications that I didn't need, and I knew that they were in my system, kind of just not leaving, hanging out is what it felt like. I would tell my husband, it feels like things are clinging on to me and I'm not detoxing them. I don't know how to detox these things. We actually did stop our treatment in February. I had 10 rounds of paclitaxel chemotherapy. I did have 2 doses of Keytruda, which is an immunotherapy drug given for triple negative, the Keynote 522 regimen. And I actually did not need that, but it's caused a few side effects. We are now dealing with some adrenal insufficiency as my cortisol did tank down to 0, and my it's like a chronic it's like a dry mouth that we've been dealing with, and they're saying that that's also a Keytruda response as well. So I just decided, as you will know, Ellen, that I did not want to take it lying down. I do not think that things are permanent. I believe that everybody's just practicing, and people put a lot of money into their Botox and into their concert tickets and our makeup and our vacations, but we don't put enough money into our health. And we do like to just sit back and see what insurance will and will not cover. And I am not about to go down by the word of insurance. So we, as in my husband and I, have been on a journey. We have hired a functional doctor. We've now got Ellen on our team for the lymphatic drainage massages, and we've got a great team that does the chiropractic, and we've got it's like a very high, I can't remember the frequency, but it's one of the stronger red lasers for like neuropathy, because carboplatin and paclitaxel have a very high neuropathy side effect. So with that team, we've been doing a lot of work, and I am so thrilled to say that after the 10 chemos, we went from an 8.4 centimeter tumor to a 4.4, and from there, stopping chemo, we are now down to a 2 centimeter tumor with no chemo. That's just from working with Ellen and working with our chiropractor and our red laser therapy and our functional doctor. And as you know, our functional doctor is going to do a lot of things that the naturopath would do, your diet, your supplements. You want to create a very non-inflammatory environment, because cancer loves high inflammatory. And with Ellen's help, she's done a lot of that too. And now she's kind of addressing not only the lymphatic system breaking away dead tumor collection, but also the adrenals that we're dealing with. So we've already seen, we've done, I think, 4 sessions since I was diagnosed with the adrenal insufficiency. And we've already gone up from unreadable. That was 6 weeks. That's 3 blood panels of unreadable. And then after 4 of those, we went up to a 2 on the last blood draw. So there's improvement where the doctors just want me to take steroids. We're just choosing to do other methods. So I hope that kind of sums it up. Do you think that does well enough?
That sums up where you've been,
Yeah.
what you're doing now, and then what is the plan?
So from here, I want to continue doing the lymphatic drainage because, like I said, high inflammatory cancer creates, it's not really the cancer, it's some of the cancer, but a lot of it is the medication that they pump you with. And now being on steroids, you even have a very inflammatory, environment with steroids, because while it could help one area, it does not benefit another area. That's the problem with a lot of our pharmaceuticals. It might help you here, but then it's got a list of side effects that are like da 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 da, and you're like playing Russian roulette with which one you might take home. You're the
Right.
lucky winner of dry mouth, you know? So, our goal right now is to get completely medication free before we allow the double mastectomy to happen. I know that the double mastectomy is important, especially with the BRCA2. I do find that that is something I want to do just for my future, and I want to be around to see my 4 children grow up, and I believe I will be, but there's things that I could do to kind of, take the chances down with BRCA2. It's kind of like if you had, I hope this isn't a tacky example, but my husband explains it like you're playing beer pong. And he's like, imagine you have all these solo cups and somebody's blindfolded and they're throwing the ping pong ball. And he was like, if you have 100 cups, is he more likely to get the ping pong in the cup, or if you take cups away? And I'm like, well, if you take cups away, it's harder. He's like, that's what we're doing with your surgery. When with the double mastectomy, you just are taking away more chances of that reoccurrence. So it is an important surgery that we want to get to, but we don't want to do it from a place of disadvantage where my adrenals are being sustained off of IV fluids that are steroid packed. We don't want to do a double mastectomy with my hydration and the dry mouth in my system so unbearable that they could send me home as an outpatient, and then we maybe go dehydrated and it's a hamster wheel of going back into the hospital after a major surgery. So we are waiting, and in the wait, working with our team. So it's Dr. Anderson, and we've got Ellen, Gwen, Clyde, and just it's a great team, I think, to get me there. So that's our next goal, is to get surgery at a healthy point instead of a unhealthy point.
Right. I want to give a shout out to Dr. Anderson, who is in Dallas, and to Gwen and Clyde with Integrated Body Health. They are here in Carrollton. All of them are phenomenal, and we are really excited to be a part of your care team. And we want to get you healthy enough, well enough, strong enough
Yes.
to be able to go through these surgeries, and
Yes.
then support you post surgically as
Yes.
well. But yes, if you're going into surgery and you're already at the bottom, it's really difficult for your recovery. So I'm glad that you have been not letting the system push you around, that you have told them, no, I really want to wait.
Yes. I think it's really important for people to know that, and I'm guilty, I'm going to come from a place of honesty and transparency when I say that being 39 weeks pregnant, having doctors look at me and say, your cancer is growing at a 65% growth rate, you don't have much time. And it was a very open ended statement. And I'm like, I was pretty feisty. I'm like, I don't have much time for what? Like, say it. Like, I'm pretty feisty. And they were like, you would have a better prognosis if we could jump on this. It wasn't just like, well, you're going to die. It was just quickly like, we want to encourage you to get into treatment fast. So being pregnant and having 3 young children, 8 and under, that was a lot on me hormonally, all the things. And I did for about 48 hours give fear my attention, and I was like, well, they wanted a C-section and we refused. So the baby actually came on his own at 41 and 3, and we had a beautiful home birth that we truly believe God honored us with, because I just felt like a C-section would have created more of that disadvantaged playing field. I would be coming from an open wound, not an open wound, but a traumatic wound that has to heal. And then
Yes.
if anybody's ever had a breast MRI done, you well know that it's the hardest MRI that they can get, the hardest image, because you have to lay. And the points of pressure are right across where the C-section scar sits and right in between your breasts on the breastplate. And then they clamp your breasts in to get the images, but your body weight is pressing onto these like very tight pieces of plastic, like sharp. So they try to pad them the best they can, but I was in pain from a natural birth, laying on the MRI table 10 days later. I can't imagine having had that wound and those, sutures and things like that to deal with. So I was thankful that we held out and that God really did honor that labor and delivery. It went beautifully. We had a great midwife. Shout out to Liv. She was amazing. And so the other thing that I rushed into, and I probably would do differently now, is I was told, because it was triple negative and it was so advanced, we needed to get the ovaries out immediately. And they said we could wait till after chemo or we could do it now. And in our minds, we were like, well, I'm already going into this journey, and it just feels like if the ovaries are going to keep creating like hormones that are feeding the cancer, let's cut this part out. So we did do the surgery where they take the ovaries in the tubal. It's like a tubal, and I don't know, it's like, do you know what that one's called? I can't remember. It's slipping my mind. Well, anyways, that surgery. But I would go back and not be bullied or make decisions out of fear. And so after seeing how my body's responded negatively to just crashing the dumping hormones, I would go back and give myself a better chance to do that at the end, knowing what I know now. So when it came to time to do surgery and they were like, oh, you have to. And I'm like, I'm not making this decision from fear. I made that mistake in the beginning. I've learned now, and I want to tell people I want to encourage everybody to get second and third opinions. You have time. I don't want anybody to feel in any way that a fear-driven decision is a good decision. Do you know what I'm saying? Like, if it's chaotic to you, if it's based out of fear to you, you didn't have time to breathe, research, pray, meditate, focus, regroup. You don't need to move forward yet. And so that's what we're doing here. We're taking our time on this part of the journey with you guys, so that when I do have the surgery, I don't want to say do. Sorry about that. So when I do have surgery, I come out swinging. I don't come out on my back like, oh, you know what I mean?
Yeah, we want you to be as strong as possible.
Yes.
So then your recovery is optimal as well.
And the best thing that when I had a friend, Holly, who actually has been a client of Ellen's for a while before she introduced me to you. But Holly told me that, you might want to ask Ellen about surgery prep and specific post op treatment. And that wasn't a thing to me watching my mom battle. I watched my mom go through multiple surgeries, chemotherapy, and radiation, and never did anything after that with her body. Nothing changed. The diet didn't change, her activity level didn't change. She never came for sure to get her lymphatic system drained out. Those things just weren't taught to me by example. I didn't see it. But I did see a bad aftermath for her after every procedure and after every pill. So I just kind of felt excited when Holly said that that was something she offered. And then sure enough, when we thought we were having surgery in March, she said, let's do some pre and post treatments, and this will really help you heal quicker. To me, I'm like, ding, ding, ding. Yes. Yes. Because I don't want to sit around hurting and like puny in a chair and being like, everybody pick me up and everybody help me. And you know how you hold fluid after surgeries? Like, I didn't want to do that too. I feel like I've had 4 kids. I've already had my fair share of looking swollen.
Well, I think that's something we talked about in the video where you were on the table is one of the biggest mistakes I see people make is they are not getting lymph drainage pre-surgery. So most of us have a little bit of a cloggy lymph system. And especially if you've been going through cancer treatments. You need to get the chemo out. You need to get yourself optimized
Yeah.
so that you're strong enough for surgery. That's very different than a normal person going in for just
Yes.
general like breast augmentation or
Right.
or tummy tuck or something like that. But it is very important. It's super critical with someone who's been going through cancer treatment, but to get that lymph drainage done.